So in a lot of the dads that I interviewed with this fatherhood program, one of my questions was, well, what got you here? Why are you here? Right? What got your foot in the door? And it was the third interview I did, and the dad said, diapers. Okay. So good interviewer. Okay, my follow-up questions, right? Diapers, say more. They give diapers. I said, okay. They give diapers. Yeah, if you show up here, you take so many classes, they give you so many diapers as an incentive, basically. It was really common across family service programs. And he said, and I'll never forget this, he said, if I come here and I get diapers and I show up to, and he used the words baby mama, so the co-parent's house where my children live, and he was a non-residential father. If I show up with diapers, she'll let me see my kids. Oh. If I don't, a lot of dads talked about like a pay to play system. I got to show up with something. Which you can understand from mothers' perspectives. These are very poor mothers trying to raise these kids as primary custodial parents with as little as, the fathers had. And so I thought to myself, and I heard this over and over again, I show up because they're giving me diapers. And they stayed for all the reasons, right? The job supports, the camaraderie, a larger context for supporting their fathering goals. But enough dads told me that they were there for diapers. And I thought, if this program and these policies are really about promoting paternal, in family studies speak, paternal involvement, or helping dads be involved in their kids' lives, then diapers, this is a real big thing, right? If that's going to be what essentially a lot we're describing as a currency of fatherhood, right? I got to show up, she'll let me see the kids. This very discrete, practical object is going to be my ticket to that relational component of fatherhood. And then diapers came out in so many ways. I talked to 2 dads who were ultimately incarcerated for lack of diapers. One, I'll never forget this, through tears, he said, when I was asking about his latest incarceration stint, he said, yeah, I went to jail for diapers. I said, oh, what happened? And he said, I wrote a bad check. He says, we only had so much money. We couldn't afford both diapers and milk. And I'll never forget this. He said, I didn't make a good choice, but I made the right one.
Oh, huh.
Still chokes me up thinking about it. Because I thought, well, we, as her policies, we so often hold these, we talk about these as deadbeat dads, bad dads. And I'm thinking, these are men who don't have $20 to get both, milk and diapers. And he's a Black father. So, of course, the likelihood that he's going to be incarcerated for something as, writing a bad check. And, we're recording this right after the death of George Floyd, who was accused of doing the same thing. And so I'm thinking, okay, diapers. So I'm writing up my results, and I thought, okay, I need to go find the citation on diapers. Where's the article on, families struggling to get diapers? And there wasn't one. Wow. Not in sociology. There were a couple things coming out in public health. And so I kind of always joke that I don't find my research projects, they find me. And so I thought, okay, that's the next one.
When you got women on the phone, I understand they had to contact you, so they had to show some interest. Mm-hmm. But did it seem like they were sort of eager or almost desperate to tell someone this story?
They were very, very eager. Mm-hmm. I always have a debriefing session at the end of every interview, mm-hmm. after I turn the recorder off. And that's where it would come up most. And there were several cases where I asked the moms, I said, can I turn do I have your permission to turn this back on? Because so many of them, I would say 50 of the interviews, a lot of tears, a lot of mothers crying, and a lot of people just very, very surprised, but also very grateful that someone even recognized this as a problem. Because it's, a complete oversight and policy. No public policy systematically covers diapers, even WIC. Oh. I'm amazed by the number of, I'm amazed, but not the number of policymakers who don't know that. So it's a complete gaping hole in our social safety net, given that, when it comes to little children's, like infants and toddlers, their basic needs, they basically have 2, right? Milk or formula and diapers. And it's not covered at all. Not even recognized. And one of the things that I found is it really contributes to mother's stress and anxiety, and how diaper need undermines their sense of maternal self-efficacy. Because not only is it a problem that they're experiencing, they're working very hard to manage because, they want to do everything they can to care for their kids. But it's something they're working very hard to address that it's a need that really no one recognizes they have. Wow. And so I think it's not only the day-to-day, as a lot of respondents said, the stresses of living diaper to diaper. I love that expression because I feel like it's so profound, Instead of living paycheck to paycheck or dollar to dollar, a lot of moms talked about living diaper to diaper. But it being completely invisible, right? Like, here's this thing that you spend all of this physical, emotional, and cognitive labor trying to manage, and no one recognizes it. You go to the WIC office, you get your formula, and I'm not saying that WIC covers all families' needs, or that all families who qualify or need it get it, but at least having something like WIC or food stamps or housing support is, it codifies that this is a need that people have. Which I think is one of the main reasons that in the vast majority of cases, when I asked mothers, what is the household expense you stress about most, wasn't food, wasn't housing for most mothers, it was diapers. Wow. Because, it's not covered by safety net policies. And even when they try to ask, their WIC counselors, or if they receive like TANF, the cash aid, they ask about diapers and they're told, but your cash aid should cover that. Like, that's what you get cash aid for, everything else. And so to get back to your question of, were they grateful to share? Yeah, because it was someone who got it, it was someone who recognized that it's an actual need that mothers have. I asked mothers, I thought this is just so telling. When I asked the mothers in my research, do you know at any one point how many diapers you have on hand? Absolutely, I've got 7 right now, or I've got 12, 5. And they knew to the hour, not the day or the week, but to the hour of how long that very specific number of diapers would last them. If you had asked me when my daughter was in diapers, I'd say, I have a box or 2 in the closet. I stock up when I'm on sale, a couple hundred because I don't want to run out. But just, I think there's really something here about just it's not just the physical labor of diapering, right? It's not just and I think from a middle class perspective, that's kind of what we focus on, right? Like, diapering can be tedious, you got to dispose of it. It's not pleasant, right? You're literally dealing with feces and urine. But I think if we really focus on that middle class perspective, we're actually missing I call this diaper work, this really key aspect of care work that's very much created by the specific conditions of poverty and economic deprivation and a shrinking social safety net. Because you do have mothers who, if you can just think about how much, cognitive energy and labor it requires to keep track of, I just used this diaper, so now I have 7 more. I know how often she pees and poops between now and when I'll get money, which will be tomorrow around noon. Okay, those, 7 diapers, which will probably be 6 in about 4 hours. And the way that mothers would recount, I'm sitting there and even, talk about kind of a middle kind of white privileged perspective. I was reminded over and over again how my understanding of diapering and my experience of diapering was so fundamentally removed from what these mothers were experiencing. And I think getting back to that point about positionality, when you have people in positions of power that have the ability to address this at a more structural level, like people who can pass policies or fund diaper banks, this was not their experience of diapering. There's the fact that most of them are still men, and men are much likely to do diapering in any socioeconomic class. But this is just not something that most policymakers have ever thought of or experienced or considered. And when I give public talks about this, the most common question I get, and I think this says a lot about positionality and privilege, is, well, if you can't afford disposables, just use cloth. There's the easy solution. And of course, cloth actually ends up being more expensive in many ways. The startup costs are greater. You still have to launder them. Most parents in poverty don't even have washers and dryers in their house. Many of them don't even have homes. What does it even mean to have to wash disposable diapers when you're living in a shelter with 200 other people, or when you're living in your car? You can't use them for daycare. So there's just all these reasons that the cloth solution is not a real meaningful solution. But that's the question I get asked most often, right? It's simple. It's simple. Just use cloth.
Right.
And then fortunately, I've kind of got my spiel down about, well, can you give me 5 minutes? Can we have a conversation about why that's not really a feasible solution given the conditions in which they're parenting? And so I don't know, maybe I've changed two people's minds, but I think, and I think it gets back to maybe one of, I think, the questions. I appreciated all your questions, but why it's so important to have research on people who are not like us. And people, at least from my perspective, who are not privileged in the same way, is because if I had gone and interviewed 100 middle-class mothers about their experiences of diapering, they just wouldn't have been the same stories. They're profoundly, it's a very classed experience. They're profoundly different. And I would have said, yeah, I didn't like changing dirty diapers. I didn't like changing the diaper genie. That's not what these poor mothers were telling me when I asked them about their experiences with diapers. So
Totally different. Yeah.
So diaper banks, there's about 300 to 400 nationwide, and they work much like food banks in the sense that they collect, donations or in-kind goods like diapers, maybe that, someone bought a pack of size 3 and the baby grew out of it before they finished up that pack, and so the parents donate. And then they distribute those to parents in need. I do want to make a plug. We have at Fresno State the country's very first university-based diaper bank.
Right. All right.
Yeah. So when I started this project, I pitched that as an idea for President Castro's Bold Idea Challenge. And I said, we know that 1 in 4, it's probably more at Fresno State, but we estimate that about 1 in 4 of our students at Fresno State are student parents or have, primary responsibility for children. And we also know that 1 in 3 parents in the U.S. struggle with diaper needs. So, do the math, and that means that quite a few parents and caregivers at Fresno State, our students and our staff, are likely struggling with this, and got a lot of support from him. And so there actually is a diaper pantry on campus through the cupboard, the student cupboard. And so any Fresno State faculty, student, or staff can go to the student cupboard and get diapers. It's funded through a state grant. And the name is Diapers for Degrees.
I see.
Yeah. I like alliteration, so I wanted to come up with a catchy name. So, and it's something in my research, I talked to quite a few Fresno State students who were struggling with diaper need, and they said, when I don't have diapers, you can't take as many of the people listening who have taken kids to daycare, signed up kids for daycare, they won't take your child if you can't provide a certain number of diapers. And most won't take any kind of cloth diapers, and they're not really cheaper anyway. That's a whole other conversation. But if you can't take your child to daycare, you can't provide diapers for other caregivers, you can't go to class. And so I talked to a lot of parents, student parents at Fresno State, who are having to miss class because they couldn't utilize daycare, or who had to decide between things like paying tuition or paying for books, or in many cases, unfortunately, paying for their own food. A primary way that, unfortunately, that mothers that I spoke with manage diaper need is they went without their own food, their own clothing, their own shoes, and especially their own hygiene items. So a lot of moms telling me, I can go without my period supplies. Like I've talked to mothers who hadn't bought tampons for a year because they were using that money to save it for diapers, or alternatively using the diapers for their own period supplies, or donating. I talked to many mothers who donated blood plasma. I mean, it's a lot of mothers making a lot of sacrifices to provide the diapers their kids need. And we know, right, when you're sitting in class and you haven't eaten for a couple of days, or you're so worried about when your baby's diapers are going to run out, that's not conducive to, a good learning environment. So the diaper bank we have on campus, I think, is really recognizing that if, providing something like diapers is a way of providing educational support for our students.
Wow. I'm glad it's there. Thanks for your work on that.